Hello, welcome to Dr. Akinclicks, and I am Dr. Akin. Today I am going to share with you a very important blood test that is done in a diabetic person or while screening for diabetes. Among many other tests that is done like fasting blood sugar, post-meal blood sugar, another important test is done, that is HbA1C test. It is also known as Glycated Haemoglobin Test or Glycosylated Haemoglobin Test. It is a 3-month blood sugar control test and expressed in percentage. So be with me till the end of this video to know what is HbA1C test, what are the values, and why it is important for us to know about HbA1C test. Hemoglobin is a major protein of red blood cell. The red color of red blood cell is because of the presence of hemoglobin. The lifespan of red blood cell is 3 months. So, the HbA1C test is the average blood glucose level for the past 3 months. In a normal person, when blood glucose level is elevated, the pancreas gland secretes insulin to counteract the elevated blood glucose level. In normal person, when the blood glucose level is elevated, the blood glucose is channelized into major tissues like liver and muscle. But in a diabetic person, the insulin is not secreted or it is not functioning properly. So in a diabetic person, when the blood glucose level is elevated, the channelizing of the blood sugar into the muscles and other major tissues like liver do not take place or is totally abrogated. Once the glucose level is very high in the blood, it encounters with the red blood cells, and it encounters with the red blood cells and hemoglobin which is present in the red blood cells. So the glucose coats the hemoglobin, or we can say that hemoglobin is attached to glucose. This is called glycation of hemoglobin or glycosylated hemoglobin. And the extent of coating of glucose to hemoglobin is expressed in percentage. Therefore, higher the glucose level in blood, more it binds to hemoglobin, and there is greater the percentage of HbA1C. Now let us know what are the ranges of HbA1C. If HbA1C is less than 5.7%, we say it is within the normal range. If HbA1C values are more than 5.7% till 6.5%, we say it is in the pre-diabetic range, or we say that you are prone to diabetes, so better you take care. And if the value of HbA1C is more than 6.5%, then we say you have diabetes and you are a diabetic person. Why we need to know about this HbA1C values? If the HbA1C value is more than 7%, and if it is persistently more than 7%, then we say that you are more likely to have the complications of diabetes. We know long-standing diabetes which is not controlled, and when HbA1C value is more than 7%, diabetic complications occur in eyes, heart, kidney, nerve, and muscles. Therefore, it is good to know the HbA1C value. if the HbA1c is less than 7% or better less than 6.5% or even better to have less than 6% of HbA1c, then it is less likely that you will have diabetic complications related to eye, kidney, nerve, muscle, and to a large extent heart and other complications. It is also known to us that for every 1% increase in HbA1c value, the risk of developing diabetic complication increases by 25%. So it is always good to check the HbA1c values if you are a diabetic, and throughout the year it is good to have HbA1c values less than 7%, if possible less than 6.5%, and if even possible it is good to have less than 6% of HbA1c value. So I am sure that now you know what is HbA1c test, what are its values, why we need to know about the HbA1c value ranges. So if you want to have regular latest updates related to health and health issues, and if you don't want to miss any of the videos that I upload, please like, subscribe and press the bell icon.